on why they weren't following through and enforcing this thing. Meanwhile, we have more and more kids that are vaping these chemicals and we have no idea what's in them. So would you look at that with your department using the resources that you're asking for today?
Yeah, absolutely. We are looking at it right now. And during the Biden administration, the FDA slow-walked the approvals for U.S. vaping companies. And the U.S. vaping companies, in my view, were acting very responsibly. They were putting chips in their vapes that would make sure that young people could not use them. They were giving good information about addiction. And they had very extensive labels. They really went out of their way not to make it attractive to children. They were slow walk, so they're off the market. And in order to fill the vacuum, hundreds of Chinese companies came in with these colored, beautifully, attractive
sour grape,
comic
watermelon.
books, watermelons, all these flavors are targeted to kids. They had video games on the vapes that lure kids into addiction.
So you're in tune with that.
We are going to wipe them out.
Thank you.
We're going to get rid of all of them.
Thank you for that commitment. As a mother of a teenager and on behalf of all moms of teenagers, I know that vaping was going on in some of even our elementary and middle schools. We thank you. Using the resources that are given to you, if we were just more deliberate and aggressive in what we're doing within the agency, I think we can make a huge difference. And I want to direct your attention to one important issue. One of the things that drives me crazy is when nonsense regulations are on the books and they have no benefit whatsoever, but yet they're on the books and businesses are trying to comply with them. In our citrus industry, our orange juice producers, there is a regulation that requires a certain sugar content. It's called a BRIC standard. It doesn't affect quality or nutrition at all. In fact, our oranges now that are being produced in Florida produce slightly less sugar. But because of this arbitrary standard, producers of orange juice in Florida have now had to start importing from foreign companies and foreign nations oranges into our country to mix with our products to deliver orange juice. The standard, it doesn't affect quality or
raise the sugar content in the orange juice.
We want to lower the sugar content that's required by this regulation. I'm sure you would not disagree with that. No. But would you look into an interim final rule that would lower that slightly to save the orange juice industry domestically?
Yeah, why don't you call Heather Flick, who's behind me, or Hannah Anderson this week, and we will act on that as quickly as we can.
Again, using the resources we have, just being smarter in our approach, we can do a lot to save a once thriving industry. Thank you.
Thank you.
Senator Kim.
Thank you, Chairman, Secretary. I wanted to just relay, I had a town hall, I had a fire captain show up to this town hall. Somebody who worked at Ground Zero, and he is somebody who said he was diagnosed with cancer. He said he's on borrowed time, and he was livid, absolutely livid about what he said, the administration gutting the World Trade Center health program. And we've talked through some of these cuts that have happened before, some staff cuts, some maybe brought back on, the administrator cut. I just need to hear from you. I promised this fire captain I'd ask you about this. What in the world happened? Why was the staff cut for this program? What are we to expect going forward?
I restored the staff to that program.
Why was it cut to start with?
It was, it was part of the overall budget cuts. Our agency was asked to make very, very serious budget cuts that were going to be painful, and some of them should not have been made, and that was one that should not have, and I reversed it.
Were you unaware, or were you aware that the decision to cut NIOSH staff would cut that World Trade Center health program?
Well, my agency is the biggest agency in government. It's twice the size of the Pentagon. It represents about 20% of the U.S. economy. We have hundreds of institutes and sub-agencies. We try to be as careful as we can about what we cut and what we didn't. We made a couple of mistakes.
No, I don't think you were trying to be as careful as you can. I mean, that's the problem that we've seen by rushing these decisions. This was, I know, early in your time there.
Senator, I understand that if you look at this from a distance, you'd say, why don't you just do this surgically and cut one person at a time? This agency has grown so big, so fast, and everybody who comes in says, I'm going to cut it down, and nobody's been able to do it. And there was an understanding that the longer that you wait, the more the inertia kicks in. And we had to act quickly so that we can do something for the American people that is lasting. And we understood that there would be some mistakes made and that we would go back and reverse them when they were made. But it was more important to do decisive action quickly that could eliminate the metastasizing of this agency to, which was growing and growing as our health declined.
So where is this going to land now? Can you tell us right now that the staffing of the World Trade Center Health Program will go back to where it was before you became secretary?
That program will continue. There will be continuity in that program. That's
continue, yes, but at full strength of where it was before you were secretary?
The program itself will continue.
Well, look, the fire captain also raised this issue about the National Firefighter Cancer Registry, also something I promised him I'd ask you about. Why was that shut down?
Cancer, I don't know about that.
You don't know about this?
No.
Okay, well, look, what I'll just tell you is
I'm happy to work with you on it, though.
There's a National Firefighter Cancer Registry, and this is something that's part of NIOSH. And because of the cuts, when I go to the website as I am right now, it says the information on this page is not currently being updated and access to tool is limited. Firefighters can no longer enroll in the National Firefighter Registry for Cancer. So I just raise this because this is incredibly important, not just for those that were at ground zero, but just writ large across our nation to try to help our firefighters. So can you promise me that we will work together and try to get this back up and running as soon as possible?
I will work with you on this issue, Senator.
Yeah, look, I understand what you were saying when it comes to your prioritization, but I will tell you, it is sending an absolutely disastrous message, especially to our firefighters. I mean, I hope that on the list of things in this Congress that we think are bipartisan, are unanimous, it should be about supporting our heroes at the World Trade Center, especially when we have more firefighters who have died since 9/11 because of medical issues that they had working there at Ground Zero, than those number of firefighters that died on September 11th. And so if we can't even agree on that, if that is not seen as a high enough priority to try to protect, then I am worried about everything else that is more controversial, has less unanimity. So, Secretary, I will follow up with you on the National Registry, and I do want a firm answer on you on what is the final staffing at the World Trade Center Health Program. And with that, I'll yield back.
Thank you, Senator.
Senator Murray has returned. She's asked a request for 30 seconds to respond to what the Secretary had responded to her.
May I ask a question?
Yes, sir.
Yes, sir, 30 seconds. Take me down to 4 minutes and 30 seconds?
No, sir.
Okay,
I'll give you 5:30 if you want.
even better, thank you.
Mr. Chairman, thank you for accommodating and letting me speak here, because Secretary Kennedy came back and said that my constituent that I spoke about earlier was not delayed by staffing cuts. First off, she is already enrolled in that clinical trial. It's not a question of eligibility. The issue, as I stated clearly, was the delay in care that she got. And what you stated, Secretary Kennedy, is not true. I spoke with Natalie actually last night. She asked her NIH doctor directly why, and when she was informed of the delay, and her doctor at NIH said very plainly twice her care was delayed because of staffing cuts. And I would just, Mr. Chairman, I think it's important for the record to show my staff has put in inquiries with HHS leadership, and they've been unresponsive so far. And just to make it clear, this is just one case of many, but those are the facts.
Thank you.
Mr. Chairman.
Senator Scott.
Thank you, Mr. Chairman. Thank you, Secretary Kennedy, for being here with us today. I oftentimes hear you say the quote, happy to work with you. And I will say that you said it to Senator Kennedy, and as a person who's asked you to work on a number of topics, when you say happy to work with you, you've actually been a man of your word. And I truly appreciate that. We talked about the importance of sickle cell anemia and the research being done, and I invited you down to South Carolina, and you took me up on my offer. You came last month, and I really appreciate you taking the time and investing the energy to talk about an issue that's critical to so many folks, specifically African Americans. And as a guy that is thankful that we are working to eliminate diversity, equity, and inclusion in the federal government, I do not want some folks to think that all things racial are somehow DEI. And frankly, sickle cell anemia is a classic example of something that has a racial nexus, but it's not diversity, equity, and inclusion. It's just a basic fact that African Americans, 99.9% of the time, are the folks that are suffering through sickle cell anemia. And frankly, if you go beyond sickle cell anemia, you find other diseases that have a consistent presence in minority communities. And to that end, I think it's really important that we continue to work together on building on issues impacting minority and other communities. And I would love, Secretary Kennedy, as you move through this reorganization that you are currently going through, I would like for you to answer the question, will you commit that programs involving minority health will continue and not get tied unnecessarily and inappropriately to DEI?
Yeah, absolutely. We will continue. I think that one of the minority health programs has been terminated, and it was one that was deeply embedded with the DEI ideology, but there are 7 others that are going to continue. I want to thank you for inviting me down to South Carolina. That was a wonderful trip. It was really, I got to witness a microcosm, a template for how medicine ought to be working.
Yes.
You have brought together under your leadership hospital systems, pharmaceutical companies and the biotech companies that developed this new technology for treating sickle cell. And and patients. And they had all worked together to make it affordable so that South Carolina now has this extraordinary program where if you have sickle cell in South Carolina, you can get 100% funding with, I think it's 100% cure or
Yes.
close to it.
Very close to it. Thank you. I'll just ask the 2 questions as opposed to asking the preliminary to the questions. For all the parents of children with sickle cell, can you please just reassure them that the Administration of Health for America will work on sickle cell and addressing minority health issues? It's a simple yes or no. And will the full budget, and when it's released, reflect funding at AHA for both the Office of Minority Health and sickle cell activities that used to be housed in CDC?
Yeah, well, absolutely, my commitment. In fact, I had a company in this morning meeting with FDA that has a new technology that it seems as effective and
Yes.
may be even more economical. And I'm very, very excited, and I'm excited to show it to you if it proceeds, if it makes it through the traps at FDA.
Excellent.
But yeah, absolutely, I'm going to continue to make that a priority of this agency.
Great. Let me change topics quickly with my minute and 45 seconds left, since I was extended extra 30 seconds. Thank you, Mr. Chairman. I really appreciate the work that you're doing, frankly, as it relates to addressing how our food supply contributes to chronic diseases, including the phasing out of petroleum-based as part of your Make America Healthy movement. I'm really encouraged by the FDA's announcement last week approving 3 new natural color additive petitions. During your confirmation hearing process, I shared your passion for shaking up the food industry, and you are truly doing just what you said you were going to do as it relates to food additives. Because of your bold actions at HHS regarding petroleum-based food additives, the food industry responded by getting rid of these dyes in favor of natural alternatives. Thank you for your work in bringing healthier food options for our kids. Can you talk about how you will use your position to continue to build on your work eliminating artificial food dyes to further improve the quality of food sold to Americans in our quest to make Americans healthier?
Yeah, I mean, one of the big areas of neglect has been linking specific food additives and food processes to the chronic disease epidemic. The NIH has neglected that area of study. It is now the central focus of NIH. It's going to be looking at, and FDA, looking at ultra-processed foods, at sugars, and the 10,000 additives that are in our food that are in nobody else's food in the world, and looking at the impact so that we can put accurate labeling on, and when they're really dangerous, we can revoke their authorizations under GRAS.
Thank you, sir.
Thank you, Chairman Cassidy, Ranking Member Sanders, and welcome, Mr. Secretary. I have nothing personal against you. I don't even know you. But what I do know, as the former Deputy Secretary of Health and Social Services in Delaware, is how important your agency is to the lives of so many people in our country. During the confirmation, your confusion of Medicaid versus Medicare did not instill a lot of confidence. But today, as you talk about these budget cuts being painful, I am reminded of Delawareans who have come up to me and cried and said, please don't let folks take away my Medicaid, individuals with disabilities. While you talk about cutting this large department, there are talks about including more things in the department from the Department of Education. And so I'm concerned about that. And when we met in January, you committed to radical transparency and responding to all congressional inquiries within 30 days. Since then, we've sent dozens of letters. And to my knowledge, like Senator Hassan, I haven't received any responses. And given your stated commitment to transparency and your focus on efficiency and responsiveness in your opening comments, I think this is a great opportunity to get your commitment that you will respond to the letters from this committee, and also an opportunity to maybe talk about a few of the things that I wrote to you about. So let's begin with this letter. In March, I wrote to you expressing my concern about the delayed meeting of the federal vaccine experts, otherwise known as ACIP. The meeting of this committee is a key step in getting vaccines to millions of people, from babies to seniors, and delays can have negative impacts on vaccine accessibility and affordability. And while I'm glad that the meeting finally happened, we're quickly approaching flu season, and the CDC still hasn't adopted the April recommendations. And I can understand the delay, given that there seems to be no current CDC director. So in the spirit of radical transparency, my question is, who is the acting CDC director?
The acting director was Susan Menares, but she is now up for permanent director. And so she's been replaced by Matt Bozzoli.
Does this person have a medical background
I
or
believe
public health expertise?
he's a public health expert.
Public health expert. So the fact that the recommendations are kind of stuck is, and the fact that you kind of had a...
Well, can I clarify something? The ACIP does not do the flu shot.
Yeah, I don't want to get into the specifics of that.
And those, the flu shot was sent.
My question was more about, do we have a CDC director? And then I want to enter into the record information about what harms could be caused until we get one.
Is that a
We
request?
want the director.
I'd love to shift
We're
gears.
relying on this committee to
But this was my question. This is my
confirm the
time.
director.
We are senators, and so I don't want to have the same exchange that happened before with other people. I just want to ask my questions. I want to just shift gears. Your proposed compassionate budget would cut funding for multiple maternal and child health programs. And I know, as a new parent, I remember learning that my baby should sleep on their back. The NIH Safe to Sleep campaign, you've shuttered. After launching this campaign in 1994, the rate of sudden infant deaths dropped by 50%. Many parents in this room maybe remember getting their children screened for hearing loss or rare diseases. That program has also been shuttered. You've cut programs that collect data on IVF, maternal health, infant mortality, all while President Trump is calling himself the fertilization president. None of these policies are based in compassion. And my only concern, even following up on Senator Kim's question, is understanding what goes into gutting a program that has increased, the efficacy of parents and being able to take care of their children. I will, my time is expired, but I will just say, again, a budget is a reflection of priorities, and to me, this budget, the cuts to Medicaid that are talked about right now across in the House of Representatives are going to have real, like you said, painful impacts on people's lives. And I hope there's some real compassion in the end, and I hope that you hear from our constituents as we are hearing from them as well, and we will continue to try to fight for them. So I yield back.
You've left me no time to respond, but I can assure you that I will act with compassion.
Senator Also Brooks.
Thank you so much, Mr. Chairman. Mr. Secretary, I'm over here. I've been sitting through this hearing all day today and have noted that you've been unable, in most instances, to answer any specific questions relating to your agency.
Because I haven't been given time.
Well, no, you have been given time, but the point of the matter is you've been unable to answer specific questions. Sir, you are the wrong person for this job, and you had in this hearing today the unmitigated gall to say at the beginning of your testimony that China is ahead of the United States in healthcare because China does not have DEI.
I didn't say that.
Well, we can roll back the tape. You absolutely did say that.
And you will find I didn't say that.
That is absolutely what you said.
I was talking about science, and I didn't say they're ahead of us. They're ahead of us in some forms of science, certainly not in healthcare.
Well, we can roll back the tape, but nonetheless, let me go on with my questions and ask you this. You just heard about the Safe to Sleep campaign, and you have made cuts. You made it very clear here today. You have no knowledge whatsoever of the absolutely amazing scientists and researchers who you have callously fired. You know nothing about the cuts.
You can fire any working scientist, Senator.
That, sir, is not true either. But nonetheless,
it is true.
It is not true. Let me ask you another specific question. The Safe to Sleep campaign, well, then can you name, sir, which office the Safe to Sleep campaign operates out of?
The which campaign?
Well, that's the one that the senator just asked you about 2 minutes ago that prevents babies from dying in their sleep. A 30-year program inside your agency. You would agree that it's important.
I think it's part of HRSA or ACF. It's ACF.
No, actually, it's in Health and Human Services.
Yeah.
And I think, and again,
now, they're all within Health and Human Services, but the subdivision is ACF.
No, actually, the name of the office.
Administration of Children and Families.
No, let me tell you what it is. The National Institute of Child Health and Human Development. This is actually the one that your aunt, Eunice Kennedy Shriver, is the person who it's named after. And you noted just a moment ago, the senator reminded you that although this is a very important agency, prevents babies from dying, this is the same one you fired every single person in this office as of April the 1st. It is also,
as I said, there were no working scientists fired during the RIF.
We can bring you that information later, but because what you just said is not true. Well, then the question also is, in addition to firing the individuals who make sure babies don't die in their sleep, why did you cut funding and staff from the CDC's National Center on Birth Defects and Developmental Disabilities, which supports the Special Olympics? Was that a mistake? I've heard you say you've made some mistakes today. Was that also a mistake?
We switched those programs to the Administration for Healthy America. They have not been cut.
Well, the funding has been cut, and this is one that oversaw the Special Olympics. Are you aware of that?
We have not cut the Special Olympics.
You've cut the funding, and you also dismantled the Division of Reproductive Health and Women's Health and Fertility. You're aware of that, right?
We have, right now, we have 42 divisions that do maternal health, and we're consolidating them. And the mainstream media has portrayed those as cuts, but they're not cuts, they're consolidations. It's ridiculous to have 42 divisions that are all supposed to be doing the same thing with their own administrators.
Well, let me ask you a question. So it doesn't exist right now. It's been dismantled. That is a fact. that particular division, what you plan to do in the.
There's
the fact
42
of the matter is
divisions
that
on
it's been-
maternal health. We consolidated.
Sir, let me finish what I'm saying here. The fact of the matter is you have dismantled it as we speak. And are you aware, what does the assisted reproductive technology mean to you? Are you familiar with that?
Are you talking about IVF?
Well, it's assisted reproductive technology. It's a division. Do you know what it does?
Is it part of NIH?
No, it's actually a part of your agency. It's a
Oh,
part.
NIH is part of my agency,
part of
Senator. You should know that.
I do know that, but it's actually a part of, it's the CDC is where it is.
Okay, then it's CDC.
Right, okay. Let me just ask you, and again, these are all of the things you seem unfamiliar with, the ones, the programs that you've cut.
You're
Let me just ask you-
unfamiliar with my agency, that NIH and CDC are part of HHS.
Oh, I absolutely know. NIH is in my county. I was there this past weekend with
I
the
know that.
researchers that you have fired. So I absolutely know where NIH is, sir, and don't need any help from you in knowing that. I see the time. Thank you.
Senator Blunt Rochester, did you have something you wanted in the record? You mentioned something but didn't formally ask, and I want to make sure.
Yes, Mr. Chairman, I'd like to introduce this into the record. It is, the CDC has no acting director, sources confirmed. It is-
Without objection, it's entered into the record.
Thank you so
Senator
much.
Sanders.
Ask unanimous consent to enter into the record 21 letters from groups raising concerns about the HHS reorganization budget and RIFs. Also ask unanimous consent on behalf of Senator Murphy to enter 2 articles into the record.
Without objection. For any senator wishing to ask additional questions, questions for the record will be due in 10 business days on May 28th at 5 p.m. Thank you again, Secretary Kennedy, for being here. The committee stands adjourned.
Thank you very much.
Yeah, but I think it's going to be, we'll get it to you.
Get in the overflow room or?